Hi, I'm Jessie Gruman, president of the Center for Advancing Health. Last week I had my blood drawn at a commercial laboratory in Chinatown in New York City that served mostly new Asian immigrants. I asked the young African-American phlebotomist whether she spoke any Chinese. A little, she said. We have Mandarin, Cantonese, and Vietnamese staff, but many of our clients aren't familiar with Western scientific medicine, so it doesn't really matter what language we speak. If we take more than a couple tubes of blood, they think we're trying to kill them, and they get really upset. They try to pull out the needle, and they shout, and they cry. Most native-born Americans aren't particularly familiar with scientific medicine either, but we've drawn the opposite conclusion. We have great faith in science. We believe that most care is based on research evidence. We think that more medical procedures and tests are better than less, that newer ones are better than older ones, and that more expensive interventions are more effective than cheaper alternatives, according to a recent paper published in Health Affairs. Here, take as much of my blood as you need so you can tailor my drugs to my genes, we say. Our lack of understanding of Western science as it relates to healthcare leads us to hold unrealistic expectations of what our doctors can do and what the tools of medicine can deliver. In the case of the clients in the Chinatown clinic, it means that they don't, in fact, die from their blood draws. In the case of many in the population at large, it means learning through experience that treatments fail and errors are made, that sometimes new evidence shows a drug that's meant to cure instead causes harm. It means that the ability of my doctor to calibrate my chemotherapy to the milligram doesn't mean that she can predict my survival with the same precision. Despite these experiences, many of us maintain our belief in the science-based judgment of our physicians to deliver to us procedures and technologies that will cure our diseases and trust our suffering. A recent CFAH report found that most of us act consistent with this belief. We expect that our doctors will tell us everything we need to know and are reluctant to ask questions because the answers may be too technical to understand. So often we leave our appointments without knowing what we must do to follow up. Unaware that all evidence is provisional, we favor binary information. Should I stop smoking? Yes. Should I get a lumpectomy? Yes. And so rather than learn about and weigh the trade-offs of testing and treatment alternatives, we defer decisions about them to our physicians. Just as the patients in the Chinatown clinic struggle to adjust to a Western approach to diagnosing and treating illness, we U.S. nationals are going to have to adjust to the challenges posed to us by healthcare today. The same wave of scientific advances in medicine that promise more cures and better quality of life simultaneously demand more from us. It's rare that there's only one clear approach to treating a condition, which means that we have choices. Not only do we have to get the test, take the pills, and change our lifestyles in order to realize the promise of those advances, we must work with our doctor to decide whether and which tests, pills, and devices will work best for us and fit with our insurance coverage. We should start first by simply asking more questions about what we might do, about what we must do, and how we will benefit. Or we may find ourselves doing some shouting and crying of our own.